Yeah, good afternoon, everyone. I congratulate the MARPCON team of Latur and also Dr. Girish Mendarkar sir and Dr. Ardavad and Sabde sir and all the team for the excellent organization. As I represent Marathwada from your zone, and it is my Karma Bhumi, Latur also, from though I am from Aurangabad. And let me begin the talk, and I will stick to the time that I will promise to you. So the disease which we know always is the communicable diseases that we hear everywhere in the conferences. It is a non-communicable disease that we will be talking about. So what do you mean by non-communicable disease, and why we want to see these diseases, as we know that these are the adult onset disease rather than the pediatric diseases. But dear friends, now it is becoming a adolescent disease, so that's why we want to become aware and make the public aware also. So the NCD burden we will be seeing global, also in India. The risk factors what are associated with this NCDs, the life course disease. What do we mean by this? NCD is a life course disease, lifestyle disease, and also we will learn about how to prevent it and earlier detection by us pediatricians, neonatologists, adolescent pediatricians, family pediatricians, and also how to reach in the community at the school level. In a brief, I am going to talk about it. So, respected friend, communicable disease we all know. The non-communicable one is the one where it is a medical condition or disease, which by definition means that it is a non-transmissible disease. NCD may be a chronic disease of long duration and slow progression, or they may result in more rapid death, such as some time of sudden stroke. The most common that are seen is diabetes, obesity, cancer, Alzheimer's, and these are different, but most common thing also the cardiac ones, as well as the ones we will be seeing others again. So the non-communicable disease, this is the toll that it is taking 41 million people each year, equivalent to 74% of death occurs globally. Each year 17 million people, they die from NCDs before the age of 70 years. And most of these, the common causes are the cardiovascular diseases as well as diabetes type 2 and the chronic respiratory disease and cancers. So the death toll, this we have seen in the which the form I have seen shown you previously. So this is the state of India. According to the study report, actually 70% of more than Indian population, they have a death rate for these NCDs. So non-communicable disease, what do you mean by it? These are the diseases that we have seen in the top, that they are the one which we are seeing it. But what is the cause? The risk factors are alcohol abuse, the physical inactivity, smoking, and unhealthy diets. Dear friends, these all the things are modifiable parts, the risk factors. Only the non-modifiable are the age, the gender, as well as some genetic conditions. So this is also known as the lifestyle disease. What do you mean by lifestyle? We all know we are living various lifestyles. We are now our own kids are the one who are having a varied of lifestyles. But we have to see how they are living now, because it is an eye-opener for all of our parents who are now the parents of adolescents. So this is the unhealthy lifestyle some of our adolescent group are following. The unhealthy eating patterns, the lack of physical exercise, along with that the stress, the mental ill health, substance abuse, addiction. Now addiction, mind you, not only the substance and alcohol, but it is the media addiction or the net addiction that we are talking about, that is the internet, which is very, very problematic, and the sleep lack. So these are the risk factors that we know. Some are the genetic factors. These are the non-modifiable one. The environmental factor, we can still prevent it. The socio-demographic, the age, gender, race, ethnicity, education, income, and the factors of self-management. Here lies the gimmick of this disease. If we prevent this, most of the things get treated or prevented. So factors of medical conditions that are there: medications, blood pressure, lipids, glucose, virus, obesity, stress. So What do you mean by fetal origin of adult onset disease? This is the theory that has been put forward way long back in 2000, where they say that the theory of fetal origin means that the nutritional deprivation of the fetus during the critical period of the development in utero forces the baby to restore to some adaptive survival strengths, which entails a resetting of a normal course of metabolic, physiological and anatomical development. This leads to the later on lifestyle diseases which are seen in the adolescent. So dear friends, though these adaptations become maladaptive if that encounters contrasting nutritional circumstances in later life. This is also known as the Barker's hypothesis, where the undernutrition and unfavorable intrauterine environment at the critical period in early life cause a permanent change in the fetus and leads to a programming for the later on diseases in the life. Now this has come out as now a second form, where now we say it as a developmental origin of adult disease hypothesis, that is DOADH, which means that apart from the nutritional thing, the later on lifestyle patterns, that is the lack of exercise, the eating habits, the lifestyle disorders, they also along with the genes they manifested. So here we have seen that the maternal malnutrition, it leads to the fetal undernutrition, which in turn causes the decrease in the muscle mass by the alteration in the fetal pattern, as well as also there is likely to early maturation because of various stress in utero, leading to increased cortisol, leading to central obesity and type 2 diabetes later on. And along with that, the other things are that impaired development is there of the liver, pancreas and blood vessels, because the brain is spared, and now there is an insulin resistance occur, again it leads to type 2 diabetes. So this is a causation pathway. We have seen that the most important thing that the country has to do is to see for what is the urbanization, the population aging and the social determinants. The common risk factors we have already seen, the intermediate risk factors which we have to keep a very open eye, be alert, you yourself also, as we crosses the age of 30s also nowadays, there is increased cardiovascular events we are seeing in 30s male population especially. And the diseases, if they occur, they are very, very costly to treat, they are very, very morbid and also a burden to all the family. So this is in thing that the physically inactive child will cause the increased blood pressure, obesity, dyslipidemia, insulin resistance and all the multiple factors we have seen in the causative thing, leading to a physically inactive adult and leading that goes into a NCD. So here the intervention is occurring where we will play important role at a mother and infant level. At this point, if we intervene, child and adolescence, this is the period where the early intervention in this life course will prevent the occurrence of the disease in the adolescence period. So what is this life course concept? It means that from preconception to the adult to death. Means what? The preconception, here the nutrition and health of the adolescent girl, the girl who is going to become a mother, she is herself is malnourished in most of the situations. It is either because of gender discrimination or because of certain other multiple problems. Also the early marriage or early pregnancy, this also leads to a low birth weight baby and an IUGR baby, and these are known to be at cause for the increased metabolic syndrome and the adult onset NCDs. So obesity in infancy, what are the causes that are there? Inadequate or no breastfeeding, that is what we are always saying, exclusively breastfed. That is the dictum. So next is the formula or the top feeds, you have to avoid that. High density complementary foods, there we are very much prone. माझ्या मुलाला मी खीर खाऊ घालू का? माझा मुलगा तिखटच खात नाहीये, जे 6 महिन्याला आपण कॉम्प्लिमेंटरी फीडिंग देतो. Why we want to have them a test? In Western countries they give tasteless foods, weaning complementary foods, because they don't want to develop their taste buds like that, and the craving is there developed because of increase in the dopamine levels. So less food in salt and sugars. Early intervention can be done by, as I have said, the exclusive breastfeeding. Educate the families that what is the importance of exclusive breastfeeding and the NCDs. This is the time that we have to initiate them and also to educate them. And also give the less quality of food. Don't ओव्हरफीड द चाइल्ड. माझा मुलगा काही असं जाडच दिसत नाहीये तर खाऊ घाला, टीव्ही समोर बसून खाऊ घाला, मोबाईल बघून खाऊ घाला. दिस इज व्हेरी रॉंग थिंग अँड वी ऑल आर फॉलोइंग, वी ऑल आर preaching our all the patients, but still it is time to tell them in this harsh way that your child might get a cardiovascular event at the age of 20s or 30s. And also the thing is that the growth chart monitoring that we know all. In toddlers, the causes most important thing is reduce outdoor activities. Children are already in the schools for a long time. There is no playground in the school. Even in the playground of the school, they have only hardly half an hour where the 10 minutes they are chit-chatting and 10 minutes they are playing, and afterwards there is nothing. So there is no exercise. There are no playgrounds in near the homes. Whatever we are seeing nowadays, there is a concrete jungle in our metros as well as bigger cities. So no outdoor games are there, or no grounds are there to play. This sedentary lifestyle, as I have told them, they will be preferring more in doing watching the TVs or laptops or computers or playing the video games because they are seeing their fathers and mothers doing the same thing. Also binge eating, that is what we all are doing as adult also. While watching a Netflix web series, we are also eating popcorn. So why not our children? They are seeing us doing that. So this is what we have to modify ourselves. And also we know that obesogenic schools, school diet, canteens, they are also providing them some foods. Like आज काय शुक्रवार आहे ना, आज आपल्याकडे मस्त चायनीज आहे आणि मस्त काय काय गुलाबजाम आहे आणि असं म्हणून ते खाऊ घालतात आपल्या मुलांना. अँड वी आर ऑल्सो हॅपी, अरे वा आपल्या मुलाने ते खाल्लंय. So this is where the older children, the causes, the lifestyle is the most important thing. The parents are working, mother and father both are making, mother can't make dabba. So most of the children, actually the elderly children or the college going children, they will eat in the canteens, they will eat by Zomato, Swiggy, Tomato, everything at the click of the button. They have everything at their home and they will binge eat that. And they're not interested in home foods when they are eating such. We also are doing like that. We don't like to eat. Everyone here sitting here in Saturday and Sunday go out of the home and eat. That I can know. So lack of exercise and increased screen time. And challenge of adolescence, this is the most important thing. The reduced physical activity, everything is there. That what I have told, that are all the reasons which are there. And more important is the more effect of the academic pressures and also the electronic media, the mental tensions, and the increased intake of the tobacco, alcohol, substance abuse at young age, either due to the peer pressures or just because of boredom. And there are various causes. And also the advertising companies which are there on the TVs, they will also influence your child, and that is what the most important culprit is nowadays. So obesity in the slum, dear friends, malnutrition still exists. That is not the thing. But apart from malnutrition, the obesity is there in the slums, because at 5 rupees or 10 rupees, you can go out and take a chips packet. You can eat that, all the vada paos and everything from there. But they will not take a thali which is there for 20 rupees, which has all type of the food nutrients. So this is the less knowledge of either healthy balanced food, no knowledge, or their parents are also uneducated, no time, and they don't exercise at all. So adolescence is the best opportunity where we will build a positive lifestyle and also prevent from harmful habits. We can assess in clinics, headaches. Can you please be silent for a minute? I will just, hello, please. Thank you so much. So we can assess in the clinics, headaches, diet, alcohol intake can be monitored. We can increase the physical activities. We can decrease the substance abuse. Always be in an anticipatory mode, guide and be empathetic. These are the things we have already seen. And the screening for the NCDs, what you have to do, all the obese children, adolescents, high risk, history of family history. Physical examination, everyone should do a BP, BMI tracking, or the change in the centiles of the BMI. The waist circumference, which is very, very important nowadays according to the Khadilkar study, and investigation for the metabolic syndromes, where it can be done in pediatric clinics, adolescent clinics, in college camps, community checkup. And here is the metabolic X syndrome. We all know what is it. And also the IDF has given this thing that when the central obesity in the waist circumference more than 98th percentile to the age, 1 minute. And along with that, any of the two factors that has been shown, it results in the metabolic syndrome. So this is the chart by Dr. Khadilkar sir, where you can see in your OPD, take the waist circumference for boys and girls. They have shown that more than 98th percentile, it will lead to the obesity. Though your child might be lean and thin, but his abdomen is very much like tummy is very full grown. So he is going to a central obesity syndrome. So these are the charts which are available on the net. Screen the young people at the right time to prevent the metabolic syndromes, and who should be tested, that I have already told you. These are the complications of childhood obesity that everyone of you know, and our government of India and IAP has done along with Mission Kishore Uday, the Rashtriya Kishore Swasthya Karyakram, which everyone of us know, and this is the most important thing that everyone of us should follow in our practice. Along with this, government of India is taking not a NCD, it is the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular disease and stroke, and it can be done in the community in the form of the public campaign, health worker care awarenesses and education of the children in colleges. The parents role, as I already told, and you all of you are a very learned pediatricians and also the adolescent pediatricians, and they know everything. So a healthy lifestyle is what you should lead, and the school-based programs are now, Dr. Kinjwadekar sir this year is going to take the Sankalpa Swasthya Karyakram. So that is what we will be doing this year in the school programs in his presidential action plan. And also the be a voice for all the children, adolescent and young people living and affected by the NCD. Thank you so much. This is the references that I have taken. Thank you.
Thank you, madam, for such an informative lecture. I would like to request our chairpersons, Dr. Thite sir and Dr. Prasad Dharam.
Hello. Thank you, Renu madam. Our active and enthusiastic EB member, Central IIP EB member, you have made really it is non-communicable. This is a very big concern to us and community, and you have made the subject very simple. Thank you again.